Hi, my name is Dr. Maria Boulton. I'm one of the directors and GPs at Family Doctors Plus. With spring in the air, it's important that if you're travelling to places like Sydney and Melbourne, and if you have a history of hay fever or asthma, that you are aware of the risk of thunderstorm asthma. Thunderstorm asthma happens in the spring months when the pollen counts are high, and there are lots of apps on your phone that you can actually download that will tell you the pollen count in the different cities. So what happens is that during a thunderstorm, thunderstorms pulverize pollens, so pollens that are sometimes too large to get into the airway. So when the thunderstorm pulverizes these pollens, it gets into people's airways and it can cause a severe asthma attack, which is what happened a few years ago in Melbourne. The thing about asthma is that if you do have an asthma attack, you need to have your reliever medication. So if you've got a salbutamol or a Ventolin puffer on hand, because that is one of the only things that's going to save your life during a severe asthma attack. So if you're traveling down to the southern states in spring, and if there's a thunderstorm, look up the pollen count. If the pollen count is high, the recommendation is that if you have a history of hay fever or asthma, that you keep the windows closed, and that you also have your reliever medication on hand. Now, for those of you who have run out of medications like salbutamol or Ventolin, you can actually go to any chemist and purchase them without a script. Now, also don't forget your spacer. Remember, spacers are not just for kids, they're also for adults. And the way that they work is that they make more of the medication go into your lungs, which is where you need it. This is just for general information, and if you have any individual questions or concerns, we always recommend that you see your GP or one of our doctors at Family Doctors Plus.